Picture this. It's 1959. You're a 10-year-old kid in rural Virginia. It's summer. School's out. You've been playing in the woods behind your house all day, like kids do before video games existed, and parents cared about supervision. On the way home, you see a bat lying on the ground. It's flopping around weirdly. Not flying, just writhing in the dirt. You do what every curious 10-year-old would do. You pick it up. It bites you. Just a small bite, barely bleeds. You shake it off, drop the bat, wipe your hand on your jeans, and go home for dinner. You don't tell your parents. Why would you? It's just a little bite. You've gotten worse from your cat. 3 weeks pass. Nothing happens. 6 weeks pass. Nothing. You forget about the whole thing. Then, 2 months after the bite, you wake up one morning and your arm feels weird, tingly, kind of itchy, right where the bat bit you. You scratch it. Doesn't help. You go to school anyway. By afternoon you have a headache and a fever. Your mom thinks it's the flu. She sends you to bed with a bowl of soup. But it's not the flu. 4 days later, you're in the hospital. You're terrified of water. Not just don't want to drink it, but the sight of it sends you into violent muscle spasms. The nurses try to give you a sip, and you thrash so hard you knock the cup across the room, screaming, and you don't even know why. Something in your brain is misfiring. Something ancient and animal is terrified of water, and you can't control it. You're also terrified of air. A gentle breeze from a fan sends you into convulsions. You're frothing at the mouth. Your throat is paralyzed. You can't swallow. Saliva is pooling, because your body literally forgot how to swallow. 12 days after your first symptom, you're dead. You picked up a bat. And there was never, not once, not ever, a single thing anyone could have done to save you once that first symptom appeared. Welcome to rabies, the virus with the most terrifying symptom progression in human medicine, a near 100% fatality rate once symptoms start, and a kill method that reads like something a supervillain designed. Myth-busting game, true or false? Oh hey there, before we talk about what this virus is doing to your brain, let's play our fun myth-busting game. I'm going to say some myths about rabies, and you tell me true or false. Ready? Myth 1. If a rabid animal bites you and you get the shots in time, you'll be fine. True or false? True. But here's the catch. In time means before symptoms start. The second you feel that first tingle, that first fever, that first inexplicable fear of water, you are already dead. The shots only work during the incubation period, which can last anywhere from a few weeks to a year, depending on where you were bitten. Bite on your hand? Few months. Bite on your face? Few weeks. The virus travels along your nerves to your brain. The closer the bite to your head, the faster it gets there. Myth 2. You definitely know if a bat bit you. True or false? Bat teeth are so small that people have woken up with bat bites they didn't feel during the night. The CDC says if you find a bat in the room where someone was sleeping, especially a child, you should assume a bite occurred. That's how small bat teeth are. You can die from a bite you never even felt. Myth 3. Rabies shots are still given in the stomach. Extremely painful. 21 shots. True or false? False. That was the old treatment from the 1800s and early 1900s. Modern rabies post-exposure treatment is 4 shots in the arm over 14 days, plus 1 dose of rabies immunoglobulin near the wound. Still not fun, but nothing like the old nightmare people describe. The myth persists because people are still telling stories from their grandparents' era. Myth 4. Once you have rabies symptoms, there's a chance you survive with aggressive treatment. True or false? Almost entirely false. The fatality rate once symptoms begin is approximately 99.9%. There have been fewer than 15 documented human survivors of symptomatic rabies ever recorded in history. Fewer than 15. In all of recorded human history. One of them, Gina Giese in 2004, survived using an experimental protocol called the Milwaukee Protocol. It's never been reliably replicated. For all practical purposes, once symptoms start, you are dead. The virus has already destroyed too much brain tissue. What is rabies and how does it kill you? Let's talk about what this thing actually is and why it's so uniquely diabolically lethal. Rabies is caused by a lyssavirus, a bullet-shaped RNA virus. It infects mammals, all mammals, dogs, bats, foxes, raccoons, skunks, And yes, humans. You get it through saliva, almost always from a bite, though in rare cases, through a scratch or mucous membrane exposure. Here's what makes rabies different from virtually every other deadly virus. It doesn't spread through the blood. It doesn't replicate in your lymph nodes or your organs first. It ignores your immune system entirely for weeks or months. It travels along your nerves. Once the virus enters your body, it binds to muscle tissue near the wound, then hijacks your peripheral nervous system. It moves along the nerve fibers, slowly, steadily, toward your spinal cord and then your brain. It's traveling at roughly 12 to 24 millimeters per day, not fast, but relentless. And while it's doing this, your immune system doesn't know it's there. The virus is hiding inside your nerve cells, using them as a highway, invisible to your body's defenses. By the time it reaches your brain, it's too late. Your immune system finally detects it and mounts a response, but now the battle is happening inside your brain, and the inflammation that response causes is part of what kills you. The virus specifically targets your limbic system, the primitive, emotional, instinctive part of your brain. The part that controls fear, aggression, arousal, and basic survival drives, which is why rabies symptoms look like they do. It's not random damage. The virus is specifically destroying the parts of you that are most essentially animal. The stages, your complete timeline. Incubation, weeks to months, you have no idea. After the bite, the virus is multiplying at the wound site and beginning its slow nerve journey. You feel nothing, zero. Life goes on completely normally. You go to work, you watch TV, you live your life. This period lasts 1 to 3 months on average, but has been documented as short as 4 days in facial bites, and as long as 7 years in rare cases. 7 years. There is a documented case of a man who contracted rabies 7 years after his exposure. 7 years of feeling completely fine. During this entire time, the shots would save you. After symptoms start, nothing will. Prodromal stage, days 1 to 5, feels like the flu. This is the cruel deception phase. The virus has reached your brain, and your body finally notices something is wrong. Symptoms are vague and nonspecific. Fever, headache, malaise, nausea. You feel like you have the flu, but there's one telltale sign that distinguishes early rabies from the flu. That tingling, itching, or burning sensation at the original bite site. The wound might be fully healed by now, weeks or months have passed, but suddenly it feels weird again. Tingly, like something is crawling under the skin there. That's called paresthesia, and if you're experiencing it near an old animal bite, it means the virus has entered your central nervous system, and you have days to live. Most people don't connect it. They think they scraped themselves or have a bug bite. They don't remember the bat bite from 3 months ago, or they don't think it's connected. The flu symptoms send them to bed, and then things get much worse. Acute neurological stage, days 2 to 7, your brain breaks. This is where rabies reveals what it actually is. There are 2 forms this phase takes, and both are horrifying in different ways. Furious rabies, 80% of cases, this is the classic presentation. The virus is ravaging your limbic system. Your emotional regulation is gone. You swing violently between states, terror, rage, calm, confusion, sometimes within minutes. You develop hydrophobia, not a fear of drowning, not anxiety around water. The sight, sound, or even the thought of water triggers violent, uncontrollable throat spasms. Your pharyngeal muscles seize. You can't swallow. You thrash and convulse at the sight of a glass of water. The medical staff try to give you fluids, and you react like someone is trying to drown you, except it's involuntary. Your brain has misfired something fundamental about water. Aerophobia comes next. Air blowing on your face, from a fan, from an open window, from someone breathing near you, triggers the same violent spasms. Any air movement sends you into convulsions. You're hypersalivating because you can't swallow your own saliva. You're alternating between periods of extreme agitation, screaming, thrashing, biting at whatever comes near you, and periods of almost normal lucidity where you understand what's happening to you and are terrified. The lucid moments are arguably the worst part, because in those windows, you understand you are dying. You can see the terror on the faces of your family. You can feel your own mind slipping away between the episodes. And then another spasm hits, and you're not yourself again. Paralytic rabies, 20% of cases. This form is quieter but equally lethal. Instead of the violent, furious presentation, you develop progressive paralysis starting at the bite site and spreading through your body. You're conscious, you can think, but your body is slowly shutting down, muscle by muscle, limb by limb. You watch yourself become paralyzed. This form is often misdiagnosed as Guillain-Barré syndrome until it's far too late. Coma and death, days 7 to 14. Whether furious or paralytic, the endpoint is the same. The brain inflammation advances. You fall into a coma. Your body's autonomic systems, the ones that control heartbeat, breathing, blood pressure, begin failing. You die from respiratory failure, cardiac arrest, or complete neurological shutdown. Total time from first symptom to death, 2 to 12 days. 2 to 12 days, from first fever to dead. What dying from rabies actually feels like. Your full timeline. The day of the bite. You get bitten. It hurts for a minute, then it doesn't. You might clean the wound, might not. It seems totally minor. A dog bite, a bat bite, a raccoon that acted weird. You don't go to a doctor because it seems fine. This is the decision that kills you. Weeks 1 through 8. Nothing. Absolute normalcy. You feel completely healthy. The wound heals, life goes on. You have completely forgotten about the bite. Around week 8, days before symptoms, you notice the old bite site feels strange. Itchy, tingly, like a mild electric current under the skin. You scratch it, still there. You ignore it. Then the headache starts, then the low fever. You think it's the flu. Your wife tells you to rest. You go to bed. Day 2 of symptoms. The fever is worse. You're confused. You feel anxious for no reason. A creeping, bone-deep anxiety that you can't explain. You're irritable. You snap at your kids. Something feels wrong, in a way you can't articulate. Dinner that night, you reach for your glass of water, and something happens. Your throat tightens. Not pain exactly, but a horrible clenching. You can't drink. You try again. Your throat seizes, and you gag violently. Your family is staring at you. You can't drink water. Day 3. The water thing is worse. You're desperately thirsty, but the sight of a glass sends your throat into spasms before you even touch it. The nurses at the hospital, you've been admitted now, try an IV line. Even the sound of water running somewhere in the building is making you flinch. You're also confused, disoriented. You know where you are, but you keep forgetting why. You're in the middle of a sentence, and you can't remember what you were saying. Your wife is holding your hand and crying, and you want to tell her you're okay, but your throat is doing that thing again. Day 4. The episodes are coming faster now. Violent, full-body spasms, triggered by water, by air from the ventilation system, by someone blowing near your face. During the episodes, you're not yourself. You're biting, screaming, thrashing, and you have no control over any of it. Between episodes, you're you again. You're terrified. You ask the doctor what's happening. He tells you. He has to. You remember the bat. The little bat in the woods 2 months ago. You didn't tell anyone because it seemed stupid. You have maybe a week. Days 5 through 7. The lucid windows are shrinking. You spend more and more time in the episodes, and less time as yourself. Your family is allowed to visit, but they have to stand back, because during the spasms, you've scratched and bitten the nurses. You're frothing, you can't swallow, you're hypersalivating, and your body has forgotten how to deal with it. When you're lucid, you're aware of all of this. You can look down at yourself, the restraints, the foam at the corner of your mouth, the fear on everyone's faces. And you know exactly what you look like. You know what you are. A rabies patient in the final stage. You ask about the Milwaukee protocol, the experimental one. The doctor says they're trying. It doesn't work. Day 8 onward. You slip into a coma. The person you were, your memories, your personality, your voice, your laugh is gone. Your body is still technically alive for a few days, but you're not there anymore. Your heart stops on day 11. You were 34 years old. You got bitten by a bat you found in the woods. You didn't see a doctor because the bite seemed fine. Historical context and famous cases. Before Louis Pasteur developed the first rabies vaccine in 1885, rabies was an automatic death sentence. If you got bitten by a rabid animal and developed symptoms, you died. Every single time. No exceptions. The treatments in the pre-vaccine era were predictably nightmare fuel. In ancient times, physicians recommended cauterizing the wound immediately with a hot iron, burning the bite site in hopes of killing whatever caused the madness. It didn't work. Some cultures recommended killing the animal and binding its flesh to the wound. Didn't work. Mercury preparations were tried. Didn't work. Bloodletting. Didn't work. The death was considered so horrifying that physicians often quietly overdosed rabies patients in the final stages. Not legally, not officially, but there are accounts of doctors administering enough morphine to end the suffering because watching someone die of rabies was considered too inhumane to continue. Louis Pasteur's breakthrough in 1885 changed everything. A 9-year-old boy named Joseph Meister was brought to Pasteur after being severely bitten by a rabid dog. 14 bites, so severe that the local physician refused to treat him and told the family he was already dead. Pasteur, who was a chemist, not a physician, administered his experimental attenuated rabies vaccine over 13 days. Meister survived. It was the first successful post-exposure rabies treatment in history. Meister went on to work as a caretaker at the Pasteur Institute until his death in 1940. Today, with modern vaccines available, dying from rabies in a developed country is vanishingly rare. The United States averages 1 to 3 deaths per year. Globally, however, rabies kills approximately 59,000 people every year, the vast majority in Africa and Asia, primarily children under 15, primarily from dog bites. 59,000 people per year. From a disease that is entirely, completely, 100% preventable with cheap, readily available vaccines. The near impossible exceptions, Milwaukee Protocol. In 2004, a 15-year-old girl named Gina Giese from Wisconsin was bitten by a bat at her church. Her family did not seek treatment. Weeks later, she developed symptoms. She was admitted to Children's Hospital of Wisconsin, where Dr. Rodney Willoughby tried something nobody had tried before. He put her into a medically induced coma to protect her brain from its own immune response and administered antiviral medications. The theory: shut the brain down temporarily, let the antivirals slow the virus, and hope the patient's immune system could clear it before they woke up. It worked. Gina Giese survived. She was the first documented human to survive symptomatic rabies without prior vaccination. She walked out of that hospital. She went to college. She got married. She has kids. The Milwaukee Protocol has since been attempted on approximately 40 people worldwide. Approximately 5 survived. The protocol has been refined and debated and is still considered experimental. The survival rate, even with the best modern medicine, is still somewhere between 10 and 15% in ideal conditions. For everyone else, once symptoms appear, it's over. Reality check. Here's the dark irony of rabies. It is completely 100% preventable. If you get bitten by a potentially rabid animal, and you seek treatment within a day or two, you will almost certainly survive. The post-exposure vaccine protocol is highly effective. People who complete it essentially never develop rabies. But people don't seek treatment because the bite seems minor, because they don't think the animal could have been rabid, because they don't want to deal with the doctor and the shots. Because they put it off and then forget about it. And then 2 months later they're in a hospital room, unable to drink water, watching their family cry. The rule is simple. Any bite from a bat, raccoon, skunk, fox, or unknown dog, and in many regions, any wild animal, requires immediate medical evaluation. Not tomorrow, not if symptoms develop, immediately, the same day. A bat got into your bedroom while you were sleeping, and you woke up to find it there? Get the shots, even if you don't see a bite. Bat teeth are too small to feel. Because the alternative isn't just death, it's a specific death. A death that involves being aware, in your best moments, of exactly what is happening to you, of knowing that you are slipping away and there is nothing anyone can do, of watching the people you love standing at a distance because you might bite them during a spasm. It's arguably the most psychologically brutal death in medicine, and it starts with not bothering to see a doctor after a bat bite. So there you have it. Dying from rabies, entirely preventable until the moment it isn't. 100% fatal once symptoms start. A 2-month clock that you don't even know is running. And a final week that no screenwriter could invent because no audience would believe it was real. The good news is we live in an era where post-exposure prophylaxis exists and works. The bad news is 59,000 people still die from this every year because they live in places where those vaccines aren't accessible, or because they didn't think the bite was serious enough to treat. Learn from every person in this story. If something bites you and there's any chance it could be rabid, go to a doctor the same day. Don't wait for symptoms. By the time symptoms appear, the story is already over. Like and subscribe if you like this video. Stay safe, avoid bats, and if something bites you and acts weird, because the alternative is spending your last week unable to look at a glass of water without your throat trying to kill you.